We're all familiar with television shows, like TLC's Hoarding, Buried Alive, where viewers are able to take a look inside the homes and minds of individuals with hoarding disorder. For centuries, compulsive hoarding has intrigued psychologists and the public alike. But what exactly is hoarding disorder, and how can it be treated? Hoarding disorder involves a persistent difficulty discarding or parting with possessions, regardless of their actual value. This difficulty is due to a perceived need to save the items and to the distress associated with discarding them. Hoarding disorder results in the accumulation of possessions that congest and clutter active living areas and substantially compromises intended use. Community surveys estimate the prevalence rate to be approximately 2 to 6% in the United States. Hoarding occurs in approximately 1.2% of women and 1.4% of men. Individuals between the ages of 55 to 94 are almost 3 times more likely to develop hoarding symptoms compared to individuals between the ages of 34 to 44. Research also suggests that individuals with hoarding disorder are more likely to be widowed, divorced, or single. Stressful and traumatic life events typically occur before the onset of hoarding disorder or can cause an increase in already present behaviors. Treatment for hoarding disorder can include cognitive behavioral therapy, group therapy, individual therapy, home visits, motivational interviewing, family-based and multidisciplinary-based approaches, and pharmacotherapy. Although all these forms of therapy have shown to improve the symptoms of hoarding disorder, cognitive behavioral therapy is considered to be the gold standard treatment. Although studies have shown that serotonin reuptake inhibitors can improve symptoms of compulsive hoarding, using medication to treat this disorder proved to be challenging. A cluttered living environment and comorbid mental health symptoms can lead to a higher likelihood of medication mismanagement. Typically, individuals with hoarding disorder are unlikely to seek treatment on their own. However, if you think you are suffering from hoarding disorder, here are a few tips. Acknowledge and identify the problem. Tell people about your problem and ask for help. Identify an area in your home for you to clear. This can be small or large. Work on that one area consistently, at least once a day for 15 minutes. Create a timetable and recognize your achievements. Lastly, do not be afraid to reach out to a mental health professional who can connect you with different resources that accommodate your comfort needs. If you think a loved one might have hoarding disorder, here are a few tips. Step back and examine your own behaviors. Improve your communication. Change your expectations. It is important to remember that unwelcome cleanouts can cause intense distress for your loved one living with hoarding disorder. Also, cleanouts do not address the deeper reasons that a loved one accumulates things. The clutter may be gone, but the behaviors and beliefs that contribute to hoarding disorder are still there.